Hi, my name's Brant Oliver, and I'm the System Vice President for Care Experience at Dartmouth Health. I'm here with Erica Thomas, Care Experience Program Manager at Alice Peck Day Memorial Hospital. Erica, welcome. You're in a very new role at APD. Can you tell me about what you do in Care Experience and what interests you in this new line of work?
Yes, the care experience really focuses on understanding how patients perceive their care. Most people that work in healthcare have good intentions and, we want to help people. Unfortunately, sometimes those intentions and our impact don't always align. And a lot of my job is to understand those discrepancies and give an outlet for patients and family members that want to talk about their experience. And then also do the work to identify themes and figure out what we're doing really well and what we could do some work on to improve. I've always really prided myself in trying to understand other people and how others feel and why they feel the way that they do and why they act the way that they act. And our healthcare system, especially post pandemic, is really trying to reshape the way we interact and connect with our patients and our employees. And the idea that I could be involved in that in some way was what inspired me and drew me to this kind of work. And the more we show empathy, really genuinely and consistently, the more we kind of empower others to take that with them and learn from it and share it. And I think if we can harness that and we're persistent, I believe we'll really start to see some real change, and not just in healthcare. Everybody wants to feel heard and understood, right? And this job allows me to practice that empathy and advocate for people and hear them. And that's pretty great.
Erica, that's really interesting. And part of learning about that experience is observing it and talking with the people that are engaged in healthcare in as close to real time as possible. And I know you've got some thoughts on care experience rounding. This is a really effective and evidence based approach for improving care experience. What work are you doing related to care experience rounding? And can you explain why you think rounding is so important?
Yes, I am rounding with med-surg patients right now with the goal of expanding to other departments. And with rounding, I'm able to gather data and provide real-time service recovery if necessary. I ask a series of questions, and it's nice because it's not just a survey on paper, it's a real person standing in front of the patient asking them how we're doing. And also being able to ask clarifying questions. So if a patient responds really positively to something, I can ask them questions and dig a little bit deeper. And alternately, when a patient responds with a negative experience, tell me why. And I'm in this unique position where I can have a non-biased conversation with patients that have a concern or a compliment or even just need a little extra support. And being able to understand concerns and compliments from a patient's point of view is really powerful in making change. Um, Teddy Roosevelt said, "No one cares how much you know until they know how much you care." And that's why rounding and patient relations in general is so important, because it gives us an extra opportunity to show patients that APD really cares about the experience that they have with us.
Erica, thank you very much for sharing just a glimpse of the wide array of activities you're involved with at Alice Peck Day related to care experience. It's a real pleasure being with you today. Thank you for your time and effort to improve the care experience at Alice Peck Day Memorial Hospital and at Dartmouth Health.
Thanks, Brant.